Hello, everybody. I'm Dr. Ben Edwards. Welcome to another episode of You're the Cure. I chose that name 12 years ago, roughly, because it dawned on me once I started to get educated beyond my conventional medical training that the body not only knows how to cure a paper cut and mend a broken bone back together, but it also knows how to keep acid out of your esophagus and in your stomach where it's supposed to be. It knows how to keep your blood pressure normal, your blood sugar normal, and all your organs functioning perfectly and fully all the days of your life. It's incredible. It knows how to keep the oncogenes turned off. It knows how to fight germs. It knows how to do it all. It just needs to be stewarded well. And it's clear when you go back and look in the historical record and in that published evidence that lack of stewardship is what will set you up for chronic disease and acute infectious, poor outcomes from acute infections. Now, we're in a season and have been really for the past five years, it seems like even more so, that the truth is very hard to find. And I've learned, I knew it, but I learned it even more the past month throughout the measles ordeal. And so when I have an opportunity to find a doctor who appears to love patients more than their paycheck and more than their position and their title, I get real excited. And especially when they publish books, and especially when they've spent years and years and years doing the research and publishing that where I can go reference all that research on topics that I was not taught in medical school. And our guest today, Dr. Suzanne Humphries, is one of those amazing physicians who loves people, loves her patients, I would say, more than she loves her paycheck. I'm going to let her tell her testimony. But I encourage you, again, in this season where it's hard to find the truth, to just listen to her testimony and then go read her book, which I have here. I actually have the 10th anniversary. I have the original, and one of my nurse practice borrowed it, but this is a 10th anniversary, Dissolving Illusions. It is on my reading list for physicians and nurse practitioners, PAs, and medical students who call me or come to my office to train and shadow. It's on the reading list, required reading. They have to read it to get a more balanced and full perspective of the history of germs and vaccination. So Dr. Suzanne Humphries, thank you for joining us today. I know you're a busy lady, and I appreciate you taking the time to be with us and to educate my audience today.
Thank you, Dr. Edwards, and thanks for having me on.
You're very welcome. So I find testimonies very powerful. Although we were trained in medical school to call those anecdotal, and anecdotal is supposed to be the very bottom of the evidence-based pyramid, barely even on the evidence-based pyramid. We're supposed to pretty much ignore an anecdotal story. But it's one anecdotal story that got me into digging deeper into nutrition and more integrative holistic practices. And of course, many anecdotal stories later, 20,000 patients later, and many diseases, chronic diseases put into remission. I give a lot more credence to anecdotal stories. So your story is powerful, and I'd like you really just to share how is it that you came to a place, and guys, look how thick this book is, and that's small print, and there's actually a whole companion reference, very thick book to this. So how does a practicing physician, seeing many patients a day, I'm presuming like I used to, 40 patients a day, have the desire and then the time and space to go write a book about dissolving illusions? Maybe first tell us what the book's about, but really want to hear your story of transition of how you got to come to the place of writing this book.
Okay, sure. When you picked up the companion book, I'd say the first maybe 200 pages are other doctors since the invention of vaccination and their anecdotal stories. And it really shocked me to see that there were hundreds of them in published print, which, as we know, that means that there must have been far more than that, probably 1,000 times more than that didn't print and felt exactly the same way. And I believe the same is true today. And I know this to be a fact because I always save doctor letters when they are written to me, and I don't make them public because I do respect the privacy and the protection of these doctors when they do come to me and say, I agree with what you're doing, but I can't stand next to you because of, X, Y, and Z. But they're out there, and they're not saying anything because of the medical mafia that they know will come down upon them so hard and ferociously if they don't play their cards exactly right. So for me, let's see, I'm a nephrologist in 2008. I really made it, I've done my fellowship after my residency. I've been in a teaching hospital as a professor of medicine, and then I left there to go into a private practice up in the state of Maine. And so I was at the peak of my career in 2008, earning close to $300,000 a year, sometimes slightly less, sometimes slightly more, depending on our bonuses at the end of the year. I had myself a beautiful house on the edge of a city park and a river. And it couldn't have been more idyllic. And I remember one day I had a dream, and the dream was that for some reason I just wasn't in that situation anymore. I was outside of it, and it actually was felt like a nightmare to me to have lost all of that. And in some ways, it was a bit of a prophetic dream. But I remember when I woke up that morning, I was like, oh, I'm still here, and this is still my sweet life. So that would have probably been around 2004, 2005 that I had that dream, because I started that job in 2001. So in 2008, I had a few things happen. Maybe I'm a bit dense, but I had like three things clobber me over the head with the same message. And the most memorable were some patients that were telling me that I first met them on dialysis. Okay, so it was a holiday weekend, and Maine is a state where a lot of people go on holiday up on the coast, and then if they need dialysis because they're already on dialysis, then they would come as guests to our dialysis unit. And so I just assumed that this one gentleman was a guest in the dialysis unit and that he was traveling. And I remember I went in Monday morning after having the weekend off, and I said, oh, so how long have you been on dialysis? And he just started ranting. He's like, I've never been on dialysis. I've never needed dialysis. My kidneys were perfectly fine until I had that shot. And it was as if he had told 30 people already and nobody listened to him. So I was like, okay, let's unpack this. So I thought to myself, well, can flu shots cause kidney failure? Because not something I was ever taught about. I certainly did know about inflammation and the effects of inflammation on kidneys. It's very sensitive. So I started just doing literature search, and I found it so easily at my fingertips, huge amounts of case reports of this happening. And to me, look, okay, case reports are anecdotal, but when they start to pile up, are they still anecdotal? And so at that point, I just kind of tucked it, in the back of my head, and I kept going. And then another case happened. And then I started thinking, wow, maybe I should start looking at this and asking people their vaccine history when I get consulted for acute kidney injury. And so I started doing that. And lo and behold, like, you could sometimes find in the very admission into the hospital where a kidney injury happened that there was any vaccine given several days beforehand. And then there would be a blip in the creatinine, which means that your kidneys aren't filtering quite as well. So I started to notice that. And then one day I was called. I used to do my own admissions, even though it was 100% consultative. If I was to do a kidney biopsy, I would do my own admission. The biopsy would be done, and then I would discharge the patient when I felt they were stable. So I had this elderly woman who had an inflammatory kidney disease where she was losing a lot of protein in her urine. And I couldn't work it out, and I couldn't get it to stop. So having histology is really helpful to determine what exactly part of the kidney is contributing to this problem, and what kind of antibodies may be depositing, or what other facts could be involved. And so I was having my office hours. She went into the hospital. My office hours were done. I went up to do the actual admission. And when I got to the floor, she had already been given a vaccine. Actually, I think she might have been given two vaccines. And so I looked at the chart, and the signature was me for ordering it. And I just thought, well, I must have the wrong chart. And so I look again, and I'm like sitting there trying to work out in my head, like, what actually happened. And then a nurse came up and said, oh no, this is the new measure that we have, that each new patient that comes in, and apparently they run into the room before the attending physician gets there, the pharmacist counsels the patient on vaccination with a little pink piece of paper. And then if the patient agrees, the jab's given straight then away without ever consulting me. And then they put me as the ordering physician. So like that was an insult to me on so many levels that, yeah, I pretty much caught on fire right then on the ward. And so again, I carried that with me, and then I bumped into the chief of medicine in the hallway probably a few days later. And normally we'd have our small talk about, how things were going in the nephrology department and blah, blah, blah. Well, this time I had a few things to say, and I was like, yeah, I'm having a problem here because I'm noticing that vaccinations are actually giving me unwanted business. And he said, oh, well, that can't be the case. The flu shot just didn't have a chance to act in the man on dialysis that you met on Monday morning. Or he caught the flu and the flu caused, it's like literally there was every excuse in the book. And I just thought, okay, this is really weird, because anytime I would be consulted with an issue of acute kidney injury, and I would initially, we're always as nephrologists, we are always taught to go look at the medication list, look at the drug list first, because 9 times out of 10 you'll find the problem there, and it's acceptable fact in medicine. So whether it's a non-steroidal anti-inflammatory agent, an aminoglycoside antibiotic, a statin drug, I mean, you name it, there are all kinds of reasons that you can have reactions in the kidney. And so to me, looking at a vaccine felt like the most natural thing in the world, especially when a patient told me that they were fine until then, and I had evidence that his kidney function was perfectly fine until then, and that now it was so not fine that he was on dialysis. And I just thought, this is really weird. Like, why is everybody disagreeing with me here? Why am I coming up against such brick walls? And so again, what my response was, well, if I'm wrong, I'm wrong, but let's find out. I mean, that's what we do as professors of medicine, isn't it? So I just started reading more of the medical literature. And at one point, okay, it's a very long story. I'm really trying. Actually, if you want to know the full story, it's all in this book right here. I did write my autobiography afterwards. It's called Rising from the Dead, and that's kind of the long version of what I'm telling you here. So I wrote a white paper, and I submitted it to every head of every medical department, including the CEO of the hospital, the director of nursing, the chief of medicine. I didn't hear anything back from any of them. They had another meeting, which they did not invite me to, and in fact, specifically told me I was not invited to. And they discussed my concerns. And at the end of it, they told me that nothing was going to change. And so I just could not accept that. So I would just get to the floor as quickly as I could when I was consulted or when I did an admission, and I would write an order, do not vaccinate. And that really upset people. And that's when all of my notes started being monitored and read. And so I went from, being a very highly respected nephrologist, treating some of the heads of the medical departments for their various kidney issues or hypertension issues, to being persona non grata, that was, the subject of whispers in corridors and in the doctor's, treatment rooms. And even my own medical partners, while they knew that I was, at least they agreed with me on the flu shots, they were starting to learn a little bit about the others, but it was just too much for them. They just couldn't absorb it. And so after, I wanted to quit right then and there, but my medical partners were practically in tears and convinced me to stay for 2 more years so that they could replace me. And so I stayed for 2 more years during the hiring process, and they replaced me with 2 other people. And so at that point I was free, and I left, and I walked away from my beautiful, this house was so amazing. For $220,000, you could buy, back then you could buy the most amazing house in the state of Maine. And I walked away from it. I walked away from the job that I loved. I walked away from the money, the $300,000 a year, and I went down to Virginia, and I lived in a tent in a farm on my friend's property. And between that and my sister kind of helping me out, I was purposely jobless because I was then on a mission to discover what the heck was going on here and to start writing about it. And so that's what I did. And in those years, I left my job in 2011, and Dissolving Illusions was published in 2013. And by 2015, I was being invited all over Scandinavia to do lectures. And so I would spend half of the year learning and preparing about different vaccines and different aspects of infant immunity, which I didn't know before, because as you say, we're only taught the very beginning of things, and continuing medical education is really important. But unfortunately, as you know, that doctors are told which continuing medical education is acceptable, and you have to do that. So I continued to do that while at the same time doing all of my own other work. And I just felt that I didn't want to go into debt. And I really wanted to have this time to really kind of figure out what was going on here, where I was going with my life. So I chose a zero income and zero debt situation, which was living in, it was actually 2 tents. So I had my office in one and I slept in a pop-up camper.
Yeah.
And there was no electricity. There was just a cold hose for most of the time that I was there, until my friends, they wanted to get electricity installed, but it was apparently a bit of a feat because of how far away it was off of the main power. But eventually I did get electricity, and it was really interesting going back to nature that way for a while. And yeah, so the result was Dissolving Illusions. My writing partner, Roman Bystrianic, obviously was a very big part of that. And he invited me into his project, actually, sometime around 2010, it probably was, after he heard me on the Gary Null radio show. And so we started working together at that point with what he had already gathered, because he's a computer scientist and he's the one that came up with all the charts that he made after. He basically uses very well accepted vital statistics and world data. So nobody, while people can hate us for a lot of reasons, nobody has ever argued with our sources and how those charts came to be. And what got him going was that he was looking at the death rates for various diseases, not the incidence rates, because that's a different story, but the death rates for various diseases over time, starting as early as he could get vital statistics. And he noted that, when antibiotics came in and when vaccines came in, or other medical therapeutics, that they were not a strong contributor at all to the decline in deaths over time, and that there were other reasons. And so Dissolving Illusions kind of tells the story around that, like what the diseases were like when they were very deadly back at a certain point. But the reason wasn't because we were born in this planet without vaccines. That wasn't the reason. So yeah, I've kind of been there ever since, although I really thought that I was retired from vaccines, and I really wanted to walk away from vaccines, and I thought I was living my life of anonymity. And then I get this invitation to go on the Joe Rogan podcast, which, quite frankly, there was no part of me that wanted to do it. And I told my friends I wasn't going to do it, and my friends were all, and these are people that I trust literally with my life, and they said, you have to do it because it's such a wide audience, your message needs to get out. And I was like, oh my God. So I did it. Joe Rogan was amazing. He's such a gentleman, and he's such a thinker, and he's such a great host. And so I did that. And now, of course, the backlash is just as crazy as ever, if not more, because Rogan has this huge audience. So as far as I'm concerned, Joe Rogan has done more for the truth about vaccines than any person in history ever, simply because of his massive audience and his courage to bring in other sides that are not the mainstream standard. And so because of that, he's under attack now, as am I, for posing as a legitimate doctor, and using my medical license in a way that's very harmful.
Are you ready to take control of your health together? You're not alone. Dr. Ben, as well as a mission-driven team here at Veritas, created this online wellness membership because so many are suffering. We want to help more people by sharing the truth that we believe will change lives. Veritas Wellness Membership is more than just a wellness program. It's a movement designed to empower you with truth, practical tools, and a support community at a price that's accessible for everyone. One membership covering your entire household. Upon signing up, you gain access to life-changing educational resources, expert-led webinars, live movement classes and exercise series, community groups and wellness initiatives, interactive classes, as well as exclusive discounts on supplements and advanced lab testing. We also offer complimentary, unlimited peace consults, a space for you to go deeper, discover who you were created to be, and explore how stress contributes to disease. We believe in getting to the root cause and understanding why what we believe truly matters. Our team of wellness navigators are here to guide you every step of the way. So whether you're just starting your wellness journey or ready to go deeper, there's something here for you. So jump in today. We can't wait to walk this journey with you. Visit VeritasWellnessMember.com to get started.
I think are probably understating the impact you've had. I mean, yeah, Joe Rogan, huge audience. And I agree that's, people need to get educated, and there's no way better than you go on a huge audience like that. But that book, the data that's in that book, the number of, I give lectures on this topic myself, and I give all the credit to you and Roman. I bring all those charts out in these lectures. And I don't know how many other doctors and chiropractors and health coaches and truth seekers have done the same. So the ripple effect from your efforts in those 2 years with no electricity on the farm is to be commended for sure. I want to go back to something because I think I read it in the book, or I may have heard you on another interview. Back when you were starting to question this flu vaccine with this acute kidney damage, did you at one point say, "Hey guys, can we just take a time out and not vaccinate these kidney patients on the first day of admission? Let's at least wait till I get them tuned up and relatively healthy and ready for discharge. Let's just flip this vaccination to the day of discharge." Is that true?
That is 100% true. Yes, and it wasn't just flu shots. There were all sorts of shots, and that's what I said. Like, why don't we get everything healed up? And I just thought if I could negotiate that would, because look, when I come onto the scene as a consultant in an inflammatory kidney disease, the last thing in the world I need is a red herring, like a vaccine. And neurosurgeons perform neurosurgery. And in our hospital, it was very well known that the neurosurgeons did not want flu shots given to their patients post-operatively or pre-operatively. And if they were to get them, it had to be weeks before the operation, because they didn't want the confounding factor of a vaccine in with their very delicate brain surgeries. So yes, that is true. I did ask them to just wait until the day of discharge, and they said no. And then they called a consultant in from New Hampshire. I actually did a very detailed video called Honesty versus Policy that's on my Odyssey channel. I do have an Odyssey channel. I had to move everything off of YouTube because they canceled me. But that video, I did that video professionally because that was pretty much my story up until that point. And I show all the cases that happened. So the consultant from New Hampshire, what I would have hoped would happen is that the consultant would have addressed my concerns about giving vaccines in serious situations. Like, I consulted on a young man, I remember him so well, young, redheaded, very well fit man who had leukemia, and he was on chemotherapy. He was immune suppressed at the very time, and they had given him both flu shots that year before I walked into the room to do my nephrology consultation. So that was pretty horrifying. And everybody just looks at me like I'm the crazy person. I would see intensive care unit patients on ventilators being given flu vaccines. And even in the recent case in Texas, in the medical chart, the second death that probably had nothing at all to do with measles, in the chart, they wrote immunizations parents refuse. And we know that they would have vaccinated that child in hospital had the parents allowed it. And we know that, if you've read the measles chapter in Dissolving Illusions, there's a World Health Organization bulletin quoted in there that there's absolutely no wrong time to give a measles vaccine, and that the only reason not to give it is in situations where the child is going to imminently die. And the only reason not to give it in that circumstance is because the parents might blame the vaccine, when indeed it's not even the vaccine causing the child to die. So people that believe in vaccines believe that there's literally no wrong time to give it. So I would have hoped that the consultant would have answered that question, but instead, again, I was like, oh, what parallel universe am I living in? Because his response to me, which I put up the actual letter in the video, Honesty versus Policy, was that the reason that vaccination of inpatients is to become a core measure moving forward into the future. And the reason for safety was because he showed me a study where when they give vaccines to people with AIDS, that they mount antibody. And that was his defense for the safety of vaccinating acutely ill patients. And I just thought, this is so rich. They could just basically go blah, and that's their answer, and I'm supposed to accept it.
Yeah. Yeah.
So after that, I kind of lost, not kind of, I very much lost respect for the authorities in conventional medicine, and kept digging deeper. So they basically motivated me and created me to be who I am today, simply by not listening to reason back in 2008.
Yeah, it's such a common sense solution of let's just vaccinate on the day of discharge. And that's one of the big red flags I think the public has already picked up on, and now just more and more so. There's no stopping the truth. It's just going to continue to come. But that's a huge red flag when there's zero compromise. It is this way only. There's no compromise. There's no exception. One size fits all. This is the answer. If you even question it, you're a quack, crazy anti-vaxxer. I mean, that is such a red flag, and the American public have woken up to it, and that's why there's now so many people digging for the truth. But I want to go, and I do want to go into later, these health authorities and government officials and the corruption and just the lack of transparency and all that hopefully is going to be changing soon. But I want to keep this story going because, I mean, you're just talking about a flu shot and kidney injury, and you found case reports and you found some evidence, and this huge, stubborn, immovable system that won't compromise at all. Where did you go next as far as, because where a lot of my patients will start asking, well, what about smallpox? And what about polio? And what about fill in the blank? But where in that 2-year journey, where did you really start to dig? And were you planning to go look at every vaccine, or were you just going wherever the trail led you?
Right. So I started out looking at influenza vaccines and their effect upon kidneys, and literally every place that I went to try to tell somebody what I found, because my argument was so convincing, what every person said back to me was, what about polio? Some of them would say, what about smallpox? But 9 times out of 10, it was, what about polio? And I thought to myself, okay, well, what about polio? We're talking about a flu shot. And I'm not, at that point, I wasn't trying to dispel the entire vaccination schedule. I just was arguing about the flu shot. So again, they propelled me to go looking at polio. And so once I did start looking at polio, that was probably the second place I went. And it fascinated me. I just could not believe how much information was out there that was absolutely contradictory to the dogma that we were told all through our careers about Jonas Salk being the savior of the children back in the 1950s and Albert Sabin finishing the job with his oral polio vaccine. I could not believe the dirt that I dug up on polio. And so when I was living in my tent, that was pretty much what I did, is I just researched polio, and I could not get enough of it. And still to this day, I'm still discovering, like the other day, I found a new fact about polio that I didn't even know before. It's like there's, people say, would you like to do a debate? And I usually say no, because debating is theater. And people that debate are usually take lessons on it in classes, and they're skilled in how to do it. But I really do believe that the one place I couldn't lose would be a debate about polio. And I think the second place I couldn't lose would be a debate about aluminum and vaccines. And so those are two areas that I spent a lot of time in because I felt that they had a lot of good foundation for what I was noticing in my everyday life. And because it was so contrary to, and there was so much more information available about polio than people really understand, and the deceptiveness of the mainstream media and of the medical authorities of the time in terms of how they manipulated the public and how they eventually got that vaccine to be licensed and then covered up the fact that there was more paralytic polio in the years after the vaccine was deployed than there was before. And it was like autism. Remember at Simpsonwood, we just can't make it go away. Well, it was the same thing with polio. They just couldn't make the fact go away that the paralytic cases were rising. So again, they kept manipulating how polio would be described, how it would be, how how the definition of polio would be. And, that's one of the big backlashes I'm getting today about, being on the Joe Rogan show. And whenever somebody wants to give me backlash about polio and tell me, how I'm wrong, I just, and if I want to explain to you why this is happening, why there's such a big backlash, it comes up to that 1984 Federal Register. Any doubts, whether or not well-founded, about the safety of the vaccine must not be allowed to exist. Okay, and then it goes on about in light of, maintaining public support for the vaccination programs. But that's the bottom line, is any doubt, whether or not well-founded, must not be allowed to exist. And if you don't have a copy of that Federal Register, I will give it to you so that you can put it up in this podcast, because I think it's very important, because the essence of that is still quite pervasive today everywhere we look. And it's part of why we get attacked for saying anything negative about vaccination.
Yes, please do send that to me. I don't have a copy of that. So maybe give just some of the highlight, which guys, you're going to definitely need to get the book to take the deep dive. I mean, Dr. Humphries has taken the time in Roman too. And actually we've had Roman on the podcast. Y'all can go back on the archive page, listen to that too, listen to both of these, but get the book for the deep detail. But Suzanne, if you had just 5 or 10 minutes in an elevator with somebody, or say a politician who actually was open-minded and not funded by pharma, what would be the few bullet point facts to get them to maybe raise their eyebrows and get curious and go dive deeper on polio in particular?
Well, first off, a lot of people want us to write a summary of dissolving illusions. They wanted us to write a little pamphlet to summarize it. And I just say, look, the problem we have with the world today is people that want bullet points and want summaries, because it's really easy to tell a lie using a soundbite and to get everybody to believe vaccines are safe and effective and they've saved humanity. Okay, well, that's what we were brainwashed with growing up, so it works perfectly fine. To reverse that brainwashing requires more than sound bites. It actually requires, it doesn't, thankfully for you all, it doesn't require that you go and do what I did, because Roman and I have already done the work. It just requires you to read it. And look, if you don't like to read, it's on audiobook. I've made so many videos on infant immunity and on topics far beyond dissolving illusions. But all I can say is that pretty much everything we were told about vaccines has been a lie. That's my belief today. And it's not my belief because I have religious belief. It's because I have factual belief that I came out of the religious cult of vaccination that we all indoctrinated to in conventional medicine. And I looked into it myself. And I always encourage people to look into it, everything themselves. If you don't believe me, then go look into it yourself. If you think we made a mistake in the book, let me know. I mean, I just got an email this week of somebody who thinks that we made a mistake in the book, and we both looked at it, and Roman and I, we were like, nope, that's not a mistake. That's actually we have the reference for it right there, for the quote about Jenner's son, and I'm sorry, the James Phipps. There was somebody who made a criticism about an interpretation of a breast milk article that I had in the very first edition. I looked at it and I thought, they're right. I've got to make good on that. And I publicly admitted that I was wrong, and I changed the book. So, isn't that how scientists should be? Because there will never ever be settled science, because creation and nature are so complicated that scientists admittedly, honest scientists, honest immunologists admitting that they barely have touched the tip of the iceberg in terms of understanding the immune system. And yes, we do oversimplify the immune system when we talk about it. Yes, I do oversimplify when I talk about Th1 and Th2. Immunity. It's far more complicated than that. We now know there are regulatory cells and dendritic cells and all kinds of other cells that come into that cascade. But nonetheless, virologists still talk in terms of Th1 and Th2 because it's still a means of communication. It doesn't mean that it's not more complicated than that. And so I can simplify things for you, but if people really want to have the confidence that they need in order to make a choice about what vaccines to give their children or themselves, how hard to fight back against mandates, then they actually have to have information. And the most effective parents I know are the ones who have taken the time to read books, not just my book, but other books in addition. And sometimes I send them to people who have written books that aren't as anti-vaccine as mine, just to kind of let them see that there are some people that are kind of middle of the road in terms of vaccine and harm reduction and maybe spreading them out. So I'm still, to this day, I've never told somebody do not vaccinate. What I tell people is I've written a lot of information that counters the public narrative, and I think it's really important that people understand the public narrative and what I have to say, and then come to their own decision on what they want to do. Now, the fact is that most people, when they do educate, end up not vaccinating. But that's not because I told them not to. It's simply because I provided information that wasn't available to them because and I can prove this with medical articles that I've dug up over the years, but the intention of the medical system has evolved into one of getting you, the parent, to have the desired response. It's not to have you, the parent, become educated so that you can make a choice. There was once a time where parents were given pretty comprehensive risk benefit pre-vaccine information, but they found that too many parents decided not to vaccinate when that was given, so they stopped, because the end point is that they want you all to vaccinate for every vaccine that's available for diseases that they think could kill you. Never mind the fact that most diseases that will kill you in a hospital will have no vaccine against it whatsoever. Staphylococcus aureus is a big killer in hospitals, isn't it?
Yep.
Doctors are big killers in hospitals, and we don't have vaccines against them either.
True. But we can vaccinate ourselves against ignorance, and that's what the book does. And that's why I highly recommend it to physicians who contact my office curious about how I've learned what I've learned and why I have the approach I have, which is same as Dr. Humphries. It's called informed consent. And legally, morally, and ethically, we should give out all the information we have, pros and cons, risk and benefit, and let the patient make the decision, and then support them either way. And no matter what, take care of them when they're sick as best you can, regardless of their vaccination status. And I can tell you, audience, over the past few weeks, I've had the opportunity to engage with physicians and health authorities at the highest levels. And I can confidently tell you, they learned what I learned in medical school. Obviously, we all we had the same curriculums. And when it comes to vaccination, honestly, what I learned in medical school was, here's this CDC schedule. This is what eradicated childhood disease. Memorize it for the test, and then be sure to implement it in your clinics. And that in a nutshell. And then the sound bites. And Andrew Wakefield's a fraud. Andrew Wakefield's been debunked. Suzanne Humphries is anti-vaxxer. Now probably Ben Edwards is anti-vaxxer. And it's these same little just sound bites. Literally, it's sound bites. And I think you said that on Joe Rogan the other day about sound bites versus facts. And that is absolutely what I've heard throughout this past 5 weeks with the measles. And I'm talking about people in places of authority, and people in medical centers and medical schools and heads of departments teaching medical students sound bites. One, in fact, said it would be unethical to do a vax versus unvax study. Unethical, therefore it won't be done and hasn't been done. There's 7 studies right now that I can point to of vax versus unvax. Obviously, this person hasn't read those, doesn't even know they exist, but went on further to say there's no way those studies will ever even be done. So the amount of ignorance, just lack of knowledge on this subject is really astounding. So, Dr. Humphries, I mean, you obviously have your biases, and I have my biases too. I think we all have our biases, but I'm going to say, like I did at the top of the show, the bias it appears that you have, and Dr. Wakefield has, and some others that I'll be interviewing in the future, is they're biased to the patient that's sitting in front of them and what that person's telling them, and then what's best for that particular patient. But if that doesn't translate to the protocol that the institution that you're working for says it should be, then we've got a problem. And so many physicians will just cave to that, and then there's a few that won't. But could you speak into that a little bit, and just where we're at in our medical education system, these institutions, and just how far off the rails we've gone? And I do want to remind the audience, which if you're a regular listener, you know this, I say it every show, we are on the last place team, we, the United States healthcare system, and therefore doctors in that system. We produce the worst outcomes. We come in dead last place in infant mortality, maternal mortality, all mortality, lifespan, all disease categories. We're the last place team. And that's what I've been telling all these reporters who are sending me quotes from these health experts and doctors at big ivory tower institutions on the East Coast, is just remind those doctors they're on the last place team. Their protocols are producing the worst health outcomes. So Dr. Humphries, could you speak to that a little bit, and maybe to these practitioners who are listening, who kind of sense this now since post-COVID, and what's the way out of this?
Right. Yeah, well, it's been really interesting. Let's see, I graduated medical school in 1993, and things have changed so much since then. But I've had the privilege to work with some older physicians. You probably have too. Physicians that were still working into their 70s and 80s. And what I've noticed is that the education of those physicians was far deeper and more profound, and um, the the procedures that they even did were far more than the procedures that I did, which are far more than the procedures that these younger generation are capable of doing. So just for instance, like, when I was a nephrology fellow, there was a doctor named Dr. Charlie Swartz who used to take us into a room once a week and teach us the physiology that he was doing in the 1940s and the 1950s. Basically the experimentations on the glomeruli in the kidney, and how they came up with the understanding of how the glomeruli and the tubules actually work. And it was absolutely fascinating. It's like, this guy, like, nobody deserved to even clean his shoes. He was so deeply educated and committed to the process of education, that he would take 2 hours out before his day started every Wednesday to teach us, and we just couldn't get enough of it. And my senior partner just recently passed away at the age of 85, and he was English, and he was educated in England. And it was the same thing with him. It's like, these were people that they were all GPs at one point. They were delivering babies. They were doing everything. They were doing autopsies, all kinds of surgeries. It was just, they were much more well-rounded than doctors are today. Then you've got, someone like Archie Kalokerinos from Australia, who would talk about, he was doing his own autopsies on these children that were dying, 1 and 2. He wrote a book called Every Other Child, or something, Every Second Child, it's called. And it was basically what happened when they started vaccinating these young Aboriginal children, that 1, 2 of them was dying. And he was doing his own autopsies on them and finding, their insides had basically melted away from scurvy. And that once he started giving them vitamin C, the death rate went down significantly. We've got a physician up in Northland in New Zealand, where I spend a lot of time, where he will do his own autopsies as well. And he's called in as a forensic guy. And he's probably up in his 70s. So what we're finding today is algorithm driven medicine. And these young people don't have the confidence, and they don't have the education that we once did. And so they like that. They like being given algorithms. They like being told how to think and how to because let's face it, things have got more complicated since, Charlie Schwartz's day in terms of medicine, and what's evolved, and, you know, all the bad and all the good has become a bit more complicated. And I remember even in my day, just thinking, I remember during my residency, just thinking, gosh, there's so much information. When you go and you do a literature search, there's just so much there. And one day just feeling so overwhelmed by it all. Like, how can I possibly ever become a doctor when there's just all this information? And then, but you just start to digest little bits and little bits of it. Before you know it, you're kind of standing on a big rock that you can make good decisions from. But it does take time, and it does take diligence. And, so and back then look, probably you're the same as I don't know if you were before or after the Bell Commission, but I was slightly after the Bell Commission, and we were still spending far more than 24 hours a day as medical residents in the hospital, sometimes 36 to 48 hours in the hospital, and we weren't supposed to be. But today, I think they're abiding more by the Bell Commission. Was actually, I believe it was some legislature that was passed in America that doctors could only work a certain amount of time because of somebody that died of a ruptured gallbladder because they were too tired to go and check the blood work. I believe that's a summary of what happened. And so today we have, 8-hour shifts. Well, that's fine. That's really nice and gentle. But the fact of the matter is, the best place to learn is on the battlefield. And some of the best advances in medicine have happened on the literal battlefields, where there's experimentation, where there's stress, and I'm not saying this is a good thing, but the fact is that that's how you learn the most. When you spend the most time in the messiest situations, that's how we learn. Today, everything's gentle. We have, phlebotomy services that will come along and draw blood. So a lot of doctors are terrible at drawing blood. Whereas I can draw blood from a stone at this point because I worked in North Central Bronx Hospital with a lot of drug addicts, and they would need an IV, and I would find an IV because you didn't have a choice. Because you didn't want to wake an attending up in the middle of the night to do an IV. You had to do it. So, we were doing our own procedures. We were putting in chest tubes. We were putting in peritoneal dialysis catheters. Like, we were doing everything. Well, today, they're not doing any of that. They're not having the hands-on that we used to do, and they're being driven by algorithms. And so one great example is in Daisy, the second child who died in Texas. And I went through some 300 odd pages of her medical records. And the first admission, I just thought, gosh, this child, I wouldn't have discharged her. If it was up to me, I wouldn't have sent her home. And then I looked at the algorithms. They have an algorithm of, if your blood pressure is this and your age is this, if your heart rate is this and your age is this, that you're okay to go home. And I thought that's all they were looking at. They were just abiding by the algorithms rather than looking at what's in front of them. And I know even, through the 1990s and early 2000s that if I had an algorithm to go by, like for nephrology, we do have, there are payment plans, and you're not supposed to do too much, or it can cost too much. But if I ever needed somebody to have something, all I had to do was explain it, and then the patient could have it. And I don't know if that's the same anymore. But I would hope that attending physician could have said, I'm overriding the algorithm. This child still has this and this, and it's my professional judgment that she's too sick to go home. Now, the real trick would have been that they would have the keys to make her better in the hospital, and that was probably one of the bigger problems. But algorithm-driven medicine began, I believe, during my residency and into my fellowship times, but it's really come into full bloom now, where you don't really need to think that much as a doctor anymore. Aside from a differential diagnosis, which you can probably pull up on a computer now. Like, we didn't even have iPads when I was iPods. I remember the first Palm Pilots were coming out when I was an attending physician. So yeah, we were using what we learned, the see one, do one, teach one, and how we were taught in grand rounds and in our every morning reports, and going over things and over things and over things in our hands-on experience, rather than what the iPod said. Or the iPhone today. And we had, I don't know about you, Ben, but did you have a white coat that the pockets were always ripping because you had too many books in them?
Oh, yes, I did.
Yeah.
The good
So
old
that
days.
doesn't happen anymore. You could just slide a little iPhone in your pocket, and Bob's your uncle. And look, I love the iPhone. I think it's a great tool. and I use it a lot, but to rely on algorithms is a very dangerous thing. And I think we're seeing a lot of problems as a result of it. But it's what insurance companies, it's what HMOs want. They want uniformity. They want everybody walking in lockstep and doing the same thing so that they'll have the same wonderful outcomes.
Yeah. One size fits all. And that's a big problem for the one that doesn't fit the protocol.
Mhm. Yeah.
Well, if you were the attending of a hospital with some and with eager students who wanted to learn and were putting in the hours, what are some of the extra things or integrative or complementary and alternative that you would bring to the table as far as treatment goes? Because that's one part of this conversation, especially with measles, treatment. The basic standard answer, there's no treatment. You can't do anything basically. So therefore, don't even come to my office, as one patient called and told me their physician told them. Just it's unbelievable, really, the refusal to treat patients. And this little side note, I was giving a talk this week out of town and had a grandmother come up to me whose daughter had a child who was following the schedule and had a big reaction at the 4-month visit and had another big reaction after the 6-month visit and then regressed into nonverbal autism. And the mom decided that she didn't want to proceed with any more vaccinations in her now autistic child who had multiple reactions. And the pediatrician said, well, then I can't see you anymore if you're not going to follow the schedule. And she was therefore fired from the practice. That's how far off this profession has gone. But that's a little side note on that, which you're free to comment on. But therapeutics and treatment, some of the things you've learned over the years, and obviously I'm really talking about the vitamin C and pertussis, but anything else also that you want to add with the moms and the dads in mind who do have sick kids who want to do some treatments.
Right. I'm going to definitely talk about treatment, but I just want to ask you a question because you're in a general practice right now.
Mm-hmm.
And I think there is plenty of online evidence that if doctors do complete the full vaccination schedule, that they are incentivized financially. Do you
Yes.
agree with that?
Yes, I do agree with that.
And given something like, I think in 2016, it was $140 per patient if the child had all the vaccines that were needed. And in 2024, I have a document that says $175 per patient to keep 85% of it's some percentage of your children up to date. So the incentivization is not a myth. You can actually find, I've posted it on my X channel, which is DRSUZANNEH7. There's so much posting of what I'm talking about here and defending myself against the hired hands of the medical industry. So incentivization is a big thing. And that, as far as I know, it wasn't a thing, at least in my early years. But let's talk about treatment, because I just think that's a really fascinating thing. And in our 10th anniversary edition of Dissolving Illusions, we added another chapter on the toxic treatments of the past. Because one of the reasons why diseases looked so devastating in the past was because of the toxic treatments for them, such as arsenicals. You know, arsenic was was considered good for your children. It was considered good for your lungs. You could put it in your tobacco and smoke it. It was all over the place. Mercurials were, you could rub mercurials, you could swallow mercurials, you could inject mercurials. It was called, I can't remember what the name of the mercurials were, but there was a drug called arsphenamine, which was another arsenical. And we get case after case of reports in the polio chapter of some people who had had up to 10 injections of mercury and arsenic. And yet, oh, surprise, surprise, the polio didn't get better and the patient maybe died. So we know that during measles in just the 1900s, that one of the treatments was to take blood out of a parent without even knowing blood types, take 10 mLs out of a parent and inject that into the buttock of the child, thinking that you could transfer immunity from parent to child. Well, the necrosis and the inflammation that happened as a result of that was disastrous. So We have a whole smallpox, same thing. Treatment was purgatives. It was vomiting. It was diarrhea. It was putting people in a room and not giving them water, a hot room with no ventilation and no light. That was the treatment for smallpox. That was the accepted treatment back in the day. So I would teach my students about the toxic treatments of the past. Sometimes shaving the head was a treatment for fever. I mean, it just, I could go on and wax poetic about toxic treatments. But if I was to make any change today whatsoever in the entire medical system, I think what would save the most lives would be to stop the fever reducers and to educate physicians on what the medical literature actually says about lowering the temperature of a human being who has an infection. And I would want them to understand what the risks are of having an epileptic fit, what the long-term potential consequences are if they do have an epileptic fit, and what the American pediatric associations and other associations to the world say is too high of a temperature. And it's not 101.5, okay? We're talking 106 to 108. Those are the temperatures where you can really develop brain problems. And I have seen several cases where lowering the temperature actually caused the seizure to happen because, as you know, the brain is a very sensitive organ and it likes change to happen very gradually. So if the temperature goes up really fast or goes down really fast equally, you can induce a fever, a seizure. So I think that these fever reducers, the side effects of fever, and I'm going to do a whole thing on this because it's one of the things that the hired hands are now after me about my statements about fever. Look, that's another argument I am not going to lose because the medical literature says one thing, yet every hospital admission, temperature greater than 101.5, give Tylenol. Absolute rubbish, absolute disservice to every patient that's done for. And I believe it's one of the reasons, one of many, why those two girls are dead, because they were given ibuprofen and Tylenol around the clock, and it stops the process of a fever. I would become Charlie Swartz, and I would sit those kids down, and I would teach them all the things that happens during a fever, the good, the bad, and the ugly. And then I would give them the medical literature on what it says, actually, what our own medical literature, conventional peer-reviewed studies show. And then I would ask them, do you still want to lower the fever, or would you rather treat the patient now? Would you rather treat the disease now? Would you rather treat the immune system now? How about that? What a revolutionary idea. Let's give the child proper nutrition. Let's give them the right form of hydration, not flood them with sugar and salt water. And let's give them some vitamin C. Let's see before our very eyes what all these quack doctors in the past have been reporting, including myself, who have treated many cases of measles in 2019 using intravenous vitamin C. And I'll tell you, I had several of these kids came in and I looked at them and I thought, oh no. And I said to one of the parents, I was like, this child needs to go to the hospital. I'm really afraid to even touch him. And she goes, oh no, we've already been there. It was completely useless. Please, I want the vitamin C. And I was like, okay. So put the IV into him, and within an hour, he's gone from looking really gray and kind of sunken into the chair. He had to be carried in. He was 11 years old, had to be carried in and put into my chair. So weak. He was up. His rash had already changed, and he perked up like a flower that you'd given water to. And at that point, I just got really angry because I just thought, it's that easy? It's really that easy to make this thing turn around? And we're told there's no treatment? We're told that vitamin C won't do anything? And case after case, I treated probably 30 kids with intravenous vitamin C from the age of 2 up to the age of 17, all still living to talk about it. Every last one of them. There were no, this is the other thing. You want to prevent the sequelae of measles, the potential infectious problems with measles. Vitamin C is your answer. So, I mean, that's my experience. I also like vitamin D in these acute situations. I think it's ideal to get a vitamin D level if you can. And people rant and rant and rant about vitamin A. Yes, absolutely. They do need vitamin A. In a perfect world, we would get a vitamin A level on these kids, and we would then supplement. But, I've got studies that show that in the first world, when they looked at vitamin A in hospitalized children, that their levels were low, whether they had measles or not. So I think you're pretty safe. And Ben, look, we know that as doctors, we give drugs all the time to people without checking their kidney function, without worrying about the side effects, because it's just what we've always done. Well, if that were to happen with vitamin C and stopping these fever reducers, we would see a revolution unmatched by anything in history in terms of the death and secondary infection rates going down.
Yeah, I agree 100%. I've seen the same thing in my clinic, and so many other doctors, as you've mentioned, historically have seen the same thing. But again, that's just anecdotal. So we're not allowed to talk about that. But we're going to continue to talk about that primarily because our health outcomes, meaning the United States, are the worst, as I've mentioned, in the world. Our kids are sick and dying more than any other industrialized country. So until we can confess, number one, and admit that we're not the best, and that's hard to do when you're prideful and arrogant, but we need to start there. Just confess that we have been narrowly trained, inadequately trained, and there's more tools in the toolbox that we could add to our medical students, residents, and physicians' toolboxes than just a prescription pad and a scalpel. Now, a prescription pad and scalpel are great when they're needed, but they're not the answer to everything. We need to equip our doctors better with more tools. And again, the knowledge, the truth is the number one tool to have. Truth will set you free. And the Dissolving Illusions, here's the 10th anniversary of it, and the companion and reference, I highly recommend them. Dr. Humphries, how can people follow you, learn more? Of course, there's a Joe Rogan podcast. I think was that 2 hours you were on with him?
2.5.
2.5. And that was just this past week. So y'all go check that out on Joe Rogan. And then, of course, the books. Dr. Humphries mentioned her X account, but where's the best place for people to learn more who are interested to learn more?
All right, I'm going to tell you in a second, but one last word I have to say is that the treatment using vitamin C is not anecdotal. There are decades of very solid research on vitamin C. And the fact is that when doctors do their own trials and do their own studies and find the benefit of vitamin C, there will always be 5 studies that will come along after it that are done by the pharmaceutical industry to prove that that's not what happens. And usually when you see a vitamin C trial failing, it's because they didn't give enough. Just simply didn't give enough. And that's one of the ways to prove that vitamin C doesn't work, is just to not give enough of it. So you can find me, my website is drsuzanne.net. You can find me on my Odyssey channel. You can find me on X, DRSUZANNEH7. That's where I'm doing most of my posting. You can please go to dissolvingillusions.com, because that's where you can see all the different international translations. We've been translated in 8 different languages. We're on the eve of publishing in Chinese right now, which is really exciting. But we've got, German, Italian. I think I don't know if we've got Russian. We've got Russian in the works right now. We've got Portuguese. We've got several different languages. And the best place to find that is actually going to the dissolvingillusions.com website. You can find information about my autobiography, which I wrote basically for parents, because I just wanted to, it basically starts with me in high school and goes on from there to when I walked away from my job and all that I discovered after I walked away from my job and had time to think. And mostly I wrote it because the system tried to intimidate me with such ferocity. And it's the same thing that the system tries to do to parents. And I just wanted parents to understand that they're doing it to all of us. If they could do it to me, then they definitely will be doing it to you. And what kind of workarounds can we possibly have? And just a bit of encouragement. So those are the best places to reach me and Roman. Questions can be addressed on the contact form on the dissolvingillusions.com website. And if they're directed at me, Roman will send them all to me. Yeah.
Awesome. Okay, guys, so y'all go check that out. So much information out there to help you make an informed decision. And again, whatever that decision is, then we'll support you 100%. We'll always love you and treat you like you are our own family. And that's how all doctors should be doctoring, I believe. And maybe we'll get back to that place. Dr. Humphries, I know you've sacrificed a lot. You've been through a lot, so much pressure. I can't even imagine all the things. Just I got a little tiny taste of it this last little few weeks. So thank you. I know you've laid down your life almost quite literally for the people and for the truth. So thank you for that and for continuing to fight the good fight. I appreciate, and I'm glad you went on Joe Rogan. So tell your friends, thank you on our behalf also for encouraging you to do that. And if there's anything we can ever do for you, please let us know.
Thank you. Well, the fact that I have such a big audience now means that your podcast will go further when I post that too. So,
There we
and thank
go.
you for what you're doing as well.
You're welcome. All right, everybody. You can find this on all the podcast platforms and also on our website, veritaswellnessmember.com. And you can look under resources, then podcast, and there's actually a topical index and there's a vaccine topic tab, and you can click that and you'll see a lot of interviews. This will be there. Roman's interview will be there, and others. And a little shout out to Dr. Thomas Levy. He's on there too for vitamin C. And his book, Primal Panacea, has a lot of those references on the published data on vitamin C historically that Dr. Humphries was talking about. So a lot of information and resources there, so you can go get informed and make the best decision for your health so that your body can be equipped as best as it can be to go be healthy. That's our goal, is to stay out of our clinic, stay out of our office. And the more you can learn and implement what you're learning, the increased odds you won't be a standard American with standard American outcomes. So thank you for joining us today. We'll be back next week with another great show. I'm Dr. Ben Edwards. You're the Cure.